So binge eating disorder, food addiction, compulsive overeating, or emotional overeating all have different names. Binge eating disorder has special criteria, but the main thing is that people know that they're not alone, that there's other people that have this disorder and experience what they're experiencing. It's very validating. They don't feel weird or strange or as much shame, because now it's actually in the diagnostic manual. They can get treatment for it, be formally diagnosed, get treatment, perhaps even have coverage. It's similar to how Janine Roth in her books about compulsive overeating, very much the appeal to them very much is that they validate that there are people that have this problem. And so people don't feel quite so alone. Binge eating disorder shares many characteristics with anorexia and bulimia nervosa. In all three, there's aspects which are possible for binge eating. It's either about binge eating or fear of binge eating. And so all of these are about a loss of control, feeling like there is no stopping whatever is happening and going on, whether it's restricting, binging, purging, whatever the activity or the behavior that is being transpired, because there's a feeling that there is control, there's a desire for control, there's a fear that for the next binge, because there's a fear of the behavior as well as the weight gain, possibly, but it's all about loss of control. There can also be some medical complications that happen with all three of these disorders. The research has been great on binge eating disorder. We still need more research on treatment of. It's wonderful that we have the research that has brought the diagnosis into the diagnostic criteria so that people can get treatment, but more research is needed for treatment. On an individual basis, it shows that we really need to have more and more of an individualized approach to treatment and not just a blanket treatment for everyone that has binge eating disorder, let alone the other eating disorders.
It is a very important year for the recognition of binge eating disorder. In 2013, in May 2013, the APA, the American Psychiatric Association, will be publishing their new version of the DSM. And in it, we will be finding the own diagnosis for binge eating disorder, which means that we're going to have criteria to go by, which means that individuals who are struggling will be able to start to have access to a more specialized treatment, and healthcare professionals around the country and hopefully the world will be able to provide greater support. Just like anorexia nervosa or bulimia nervosa, binge eating disorder is going to share a distress relationship with food, where food is used as coping and often will reflect on a healthy relationship with body image. When treating an individual, a male or a female, struggling with binge eating disorder, we are going to be tailoring his or her needs. And by doing so, we're also going to be using a multidisciplinary team, as we know it is going to be helpful to tackle different angles of this disorder. Part of this team will include a physician, a dietitian, a therapist, a psychologist, as well as potentially even a psychiatrist if this individual is facing some depression or some anxiety or other comorbidities, as well as the use of a movement therapist, as we have found that yoga and mindfulness techniques have been extremely helpful in the treatment of binge eating disorder.